Baptist Technology Services is a hybrid of information systems, clinical informaticists, and the Baptist OneCare team. The BTS group employs a team of dedicated people whose work touches every aspect of patients' and employees' lives. From the basic computers and printers, to providing support for life-saving technology and equipment, to helping implement the rollout and maintenance of Baptist OneCare, a $340 million project which involves all Baptist hospitals, minor medical centers, and Baptist medical group clinics.
So we can see groups of engineers that are architecting a solution for our end users. We can see telecom people making sure that we can communicate with each other regardless of where we are. We have wireless network engineers that are making sure that we can communicate inside and outside of our hospitals. And of course, we have all of our application people that make sure that the tools that we have are developed so that we can implement care, improve care, and make sure that we can be efficient and effective in everything that we do.
The pharmacy robot is a robotic medication dispensing solution that increases the accuracy and efficiency for the pharmacy. The robot dispenses doses of medication for patients in the hospital. The robot uses barcode scanning technology to select the correct medication for the patient and to check the expiration date of the medication. If that expiration date is within 3 days, it'll reject that dose and pick a new one. The robot dispenses over 4,000 doses of medication in one day, and that's 4,000 plus doses that would have been picked by a human and more prone to errors.
So the Volt phone, first of all, is an iPhone and is used by the bedside team to communicate with each other and with physicians. And the nurses at the bedside can receive text messages to the Volt phone as well. When there's information that needs to be communicated to the bedside team, the nurses will send a text message to that bedside nurse. We get a list of the assignments every morning at the beginning of each shift, so we know the nurses that are taking care of the patients. So when our nurses need to communicate, they can just simply type that nurse's name into the Volt Messenger, and automatically that nurse's name pops up and they're able to see that nurse's extension if they need to call. So it's a quick way to get phone numbers as well.
The biggest convenience for patients is MyChart, a free app accessible via smartphone or computer that allows patients to schedule appointments, refill prescriptions, direct message their care providers, access lab results, and much more. The Baptist Technology Services team supports the Baptist mission of providing quality care by establishing and maintaining a standard for end-user experience across all platforms and facilities.
We are a 7x24 department, and we take calls on various technical and clinical problems that our customers would have as related to can't log in the system, can't print, and in various troubleshooting of technical issues related to our Epic product. And then we get quite a few calls on our MyChart portal, which is used by our patients to do things from checking their own stats and their own test results to scheduling their own appointments and even paying their own bills online.
We take emergency calls as well. If it's a 911 call, we'll tell the customer to call 911. It's a new adventure every day. We're a break-fix component, and anything that we cannot fix or any access we don't have, we always send it over to second-tier troubleshooting. So for all issues, call the 7s.
One of the main reasons that we are successful here at Baptist is we bridge the gap between technology and people. Oftentimes technology kind of seems confusing and clumsy, and we have people on the phone who can talk to you in layman's terms to help you get through those gaps.
In March 2015, Baptist launched the Patient Placement Center.
We work with different Baptist hospitals to move patients internally inside of the hospitals, also to move patients between Baptist hospitals, and then to move patients from physician offices and rural community hospitals into the Baptist system. Our center is very technology driven. Without technology, our center would not exist.
Nursing uses these services. The Patient Placement Center directly routes patients to the correct nursing station, to the correct level of care that they need. For a bed to be available to do that, you have to make sure that your transportation personnel are getting the information that they need, and that your EVS or your housekeeping personnel get the information they need to get the beds clean, to get patients moved.
This ultimately makes it easier for medical professionals to save lives.
So we had a request come in regarding a mother whose circumstances prevented her from seeing her newborn child. So what we did was we set up 2 laptops to basically create a video conference between the mother's room and the baby's room. This was a live feed that can be turned on or off at any time. We were able to provide that solution and gave that mother the ability to see her child, even though they were separated after the birth. So we were able to use an application used for business collaboration and leverage it for this mother to see her newborn baby.
These standards leverage IT capabilities from device, core infrastructure, applications platforms, and business productivity platforms. Our goal is to provide the perfect end-user experience in collaboration and messaging technologies. A world-class help desk that is just a phone call or email away. BTS site support and nursing informaticists that provide at-the-elbow support for our end users. Continuing to maintain never-ending efforts to make every application better, thus improving clinical and financial outcomes. Continuing to build and strengthen our workforce to meet current needs and plan for the dynamic future of technology within healthcare. Increasing patient engagement in their care through device integration, care coordination, and early intervention. But in the end, Baptist Memorial Healthcare and the Baptist Technology Services team have but one simple, true mission: to help you get better.